Hello friends, welcome so much to my YouTube channel, the drkrishnanlecture. I am Dr. Ramesh Krishnan, doing super specialization in neurology at Indraprastha Apollo Hospital, New Delhi. Do subscribe to my channel for more and regular updates on interesting topics of the medical science.
In this lecture video, I will discuss about interpretation and analysis of cerebrospinal fluid, that is CSF. The content of my lecture include indications of lumbar puncture, complications of lumbar puncture, contraindications to lumbar puncture, examinations of CSF, which include opening pressure, gross appearance of CSF, chemical examinations of CSF, cell counts in CSF, immunological examination, microbiological examination of CSF. The introduction. CSF is a clear, colorless fluid formed in the ventricle of the brain by choroid plexus, mainly by an ultrafiltration of plasma, and is contained in the ventricle of the brain, a spinal canal and subarachnoid space. Normal composition of CSF. Appearance is clear and colorless. Total volume of 100 to 150 ml and has opening pressure of 60 to 180 mm of water. Glucose content is 45 to 80 mg per deciliter. Protein content is 15 to 45 mg per deciliter. Chloride content is 120 to 130 milliequivalent per liter. Bilirubin is absent. Oligoclonal bands are negative. Cells include 0 to 5 cells and mainly lymphocytes. Normal function of CSF. It protects the brain and the spinal canal, thereby act as a shock reservoir. Serves as medium between blood and brain for supply of nutrients to and removal of waste product from brain. Collection of CSF. It is collected by lumbar puncture. Patient should be in lateral recombinant position and under aseptic precaution. 22 gauge LP needle is introduced and is collected in 3 sterile tubes. LP needle is introduced between L3 to L4 vertebra in adult and between L4 to L5 vertebra in children. It can also be collected by cisternal puncture as well as by ventricular punctures. and shunt drainage. The tube 1 is biochemistry part, that is glucose and proteins. Tube 2 is for microbiological examination, that is gram stain, bacterial culture, sensitivity. Tube 3 chemical, TLC, DLC. Tube 4 non-gynecytology, that is visualization of malignant cells and other cells. And tube 4 is the storage sample. Then complications of lumbar puncture. Important include post-puncture headache, and most common side effect, so a small bore needle of 22 gauge is used. It can lead to introduction of infection in the spinal canal. It can form subdural hematoma. There can be dry tap as well as herniation of brain. Contraindications of lumbar puncture. It include raised intracranial pressure, cardiorespiratory compromise, bleeding diastasis, local infection at the site. Then examination of CSF. CSF is examined within 1 hour of collection because cells degenerate rapidly, and reduction of glucose due to a spontaneous glycolysis as well as use by bacteria. Then opening pressure. During lumbar puncture, when CSF appears, manometer is attached to the spinal needle. It is recorded with patient in lateral recombinant position. Gross appearance of CSF. Normal turbid appearance of CSF is turbid appearance of CSF is seen with increased leukocyte count, that is greater than 200 cells per millimeter cube, greater than 400 cells per milliliter mmq of RBCs. Microorganisms like bacteria, fungi and amoeba. Radiographic contrast media. Raised proteins greater than 150 mg per deciliter, and aspiration of epidural fat during lumbar puncture can lead to turbid CSF. Then blood mixed CSF. It is seen with traumatic tap and subarachnoid hemorrhage. Then xanthochromia. It is yellowish discoloration of CSF. And it is seen in subarachnoid hemorrhage, 12 hours of bleeding episodes. Jaundice with serum bilirubin greater than 6 mg per deciliter, and CSF proteins greater than 150 mg per deciliter can lead to xanthochromia. Other abnormalities in the appearance include orange coloration of CSF with high carotene intake and brown appearance of CSF is seen in meningeal metastatic melanoma. Then clot formations of CSF. It is seen with tubercular meningitis, which leads to cough wave formation. And purulent meningitis as well as spinal blocks and traumatic lumbar puncture. Then thick viscous CSF. It is seen in cryptococcal meningitis, meningeal metastasis, mucinous adenocarcinoma, and severe meningitis. Then estimation of proteins. Normal level of CSF protein is 15 to 45 mg per deciliter. Conditions which lead to elevated CSF proteins include meningitis because of increased permeability of blood-brain barrier, a spinal cord tumor with mechanical obstructions to CSF circulation, traumatic taps and subarachnoid hemorrhage due to hemorrhage in the CSF, multiple sclerosis and SSPE, which leads to increased local production of IgG antibody. Then estimation of CSF chloride, CSF glucose. CSF glucose is measured by glucose oxidase method. Causes of decreased glucose include acute bacterial meningitis, tubercular meningitis, fungal meningitis, and hypoglycemia. CSF glucose is normal in viral meningitis. Then estimation of CSF ADA level. In tubercular meningitis, ADA level is greater than 10 unit per liter, whereas in non-tubercular causes, ADA level is less than 10 unit per liter. Then estimation of CSF chloride. It is normal in viral meningitis and encephalitis as well as poliomyelitis. Moderately depressed level is seen in with pyogenic meningitis, and pronounced depressed level of CSF chloride is seen with tubercular meningitis. Causes of pleocytosis include meningitis, intracranial hemorrhage, meningeal infiltrations by malignancies, repeated lumbar puncture, and injections of foreign substance into subarachnoid space. Conditions associated with increased neutrophil in CSF. The causes include bacterial meningitis, brain abscess, brain infarct, and repeated lumbar puncture. Conditions associated with increased plasma cells in CSF. The causes include tubercular meningitis, syphilitic meningoencephalitis. The conditions associated with increased lymphocytes and monocytes in CSF. The causes include viral meningitis, degenerative brain disorders, tubercular meningitis, fungal meningitis, sarcoidosis leading to meningitis. The conditions associated with increased lymphocytes in CSF. The causes include viral meningitis, tubercular meningitis, fungal meningitis, parasitic meningitis. The conditions associated with increased malignant cells in CSF. It includes metastatic cancers, leukemia, lymphoma, medulloblastoma, and ependymoma. Microbiological examinations, which include direct wet mount of CSF for suspected case of cryptococcal and trypanosoma infections. Other tests include gram stain, Zell-Nenzel staining, cultures for bacteria and mycobacterium, as well as PCR for microbacterium, tuberculosis and viruses. Then the pictures in the case of viral meningitis include appearance is clear, opening pressure is normal, glucose level is normal, that is between the range of 45 to 80 mg per deciliter, protein is normal to increased, that is between 15 to 45 mg per deciliter, cells are less than 300 cells per ml and predominantly lymphocytes. Then the pictures of CSF in bacterial meningitis include appearance is cloudy and turbid, opening pressure are elevated, glucose level is decreased in comparison to normal, protein level is increased in comparison to normal CSF proteins. Cells are between 100 to 50,000 and these are predominantly neutrophils. Then CSF picture in tubercular meningitis include appearance is cloudy and viscous. Opening pressure is high in comparison to normal opening pressure of CSF. Glucose level is decreased less than 30% of the plasma. That is, it is decreased in comparison to normal range of CSF glucose. Protein level is increased in comparison to normal CSF proteins level. And cells are less than 500 and mainly lymphocytes. Then the pictures in the case of fungal meningitis include appearance is fibrin waves, opening pressure is high to very high in comparison to normal opening pressure of CSF. Glucose level is normal to decrease in comparison to normal CSF glucose level. Protein level is normal to increase in comparison to the normal protein level of CSF. And cells are between 0 to 1 lakh. Mainly, predominantly these are lymphocytes. Thank you.
Thank you so much for your kind attention and watching my lecture. I will end up my today lecture with a beautiful quote defining success. That is, define success on your own term, achieve it by your own rules, and build a life you are proud to live. With this, I will end up my today lecture. Thank you all.